Lastly, we'll talk about revision rhinoplasty, and this is a large part of my referral practice. And why do we have such a large rhinoplasty revision rate? It's 10 to 20% nationally, and most of these are relatively minor revisions, a small bump here or there that needs to be modified. Some of them are major. Some require total nasal reconstruction. And this is something that really ought to be performed by folks who do a lot of rhinoplasty surgery. This is something that I think is best done by expert hands. One of the reasons is that all of the techniques in rhinoplasty may be necessary. And it's complex because of all the scarring in the nose. Often patients will have had multiple surgeries by the time they come to my office. And you have to understand that when you get in there, you may not find exactly what you expected. So you have to have the experience necessary to understand what a few different options may be once you get in there to repair things. You must be able to use different types of grafts. Often in revision rhinoplasty surgery, we'll use cartilage grafts from the rib, we'll use cartilage grafts from the ear, or other places to try to reconstruct the bony cartilaginous skeleton of the nose. They often will have functional problems, so the surgeon who approaches this needs to understand functional nasal surgery and restoration of the nasal airway in addition to nasal form. So our motto is reshape and restore in revision rhinoplasty. Patient had had prior rhinoplasty and the tip was brought up a bit too high to an unnatural appearing position. This patient actually he was somewhat tall, and so we wanted to drop this down into a more appropriate position, and simply moving things a few millimeters can make a big difference in the conformation and the appearance of the nose. Sometimes too much is taken away. In this case, the nose had been over-resected, and so we have all sorts of problems here of lack of cartilage support of this entire nasal tip area. In this case, cartilage grafts were used to reconstruct the entire nasal tip. The alar cartilages, the dorsum here, pushed these down so that there wasn't so much nostril showing and rebuild that entire nasal tip. And so this can be a very complicated surgery. In some cases, it's an issue of nasal airway function in addition to the ability to the appearance of the nose. This is a Polaroid that this patient was kind enough to provide me of himself before he had his first surgery back in 1991. And what he really wanted was for this tip to come up a little bit and this just to be a little bit straighter. 2 surgeries later, and this was the Polaroids around the mid to late 90s, and the tip has dropped and things are not looking exactly the way he'd planned. And this is the appearance of this kind gentleman when he came to see me, and he could not breathe through his nose. And now his bridge has also been built up. You can see that. Someone's gone in, and this is after 5 prior surgeries. And so his desire at this point was really to be able to breathe through the nose again. And he had external valve collapse, and we actually used bone-anchored sutures in addition to grafting techniques and removal of this graft, which was unnecessary and aesthetically gave him a bit of a Roman nose. 1 year later, here he is, a much more natural appearance, and actually it's what he had wished with his first rhinoplasty he'd achieved, and he's able to breathe through his nose, which is really what he wanted at this point. So it's really a very gratifying procedure. It's a complex procedure to perform, and something that really tests all of your surgical skills. So putting it all together, with rhinoplasty our desire is to reshape the nose both internally and externally, to restore the nose functionally and aesthetically, and put the nose in balance and harmony with the shape of the face, the ethnicity of the patient, and the psyche of the patient. So with this type of surgery, with very mild changes to the shape of the nose, we can make a profound impact on the overall appearance of the face and restore facial harmony. So rather than being one of the main features that we observe when we look at someone, it can sort of blend into the rest of the facial aesthetic. This is a patient who came to me and desired this during our computer consultation. So this is a simulation of how things were planned. She wished the bump to come down a little bit of tip modification to come up, and a natural appearance most importantly. And this is how she was about 1.5 years after surgery. So she's settled in and she's gotten pretty darn close to our plans and a very natural looking appearance. And we can look at all the different views here to show three-dimensionally how we've changed this tip a bit to fit in more balance with the face. And I'll just run through all these here. So I thank you for your attention. If you have any comments or questions, you can always email. And if you have any questions about coming in or any referrals, the number's up there, and I'd be glad to field any questions you may have. Thank you very much for your attention.